Kovar? K-O-V-A-R?
KOV is in Victor, Kovar.
And first name?
J-A-Y.
And can you tell us what's going on out here today? What happened out here today with this accreditation?
Today, Conroe Regional is having a celebration for receiving their certification from the Society of Chest Pain Centers for the treatment and evaluation of chest pain patients, cardiac patients here at Conroe Regional Medical Center. Society of Chest Pain Center is an organization that began about 5 to 6 years ago, setting up standards that go above and beyond what national hospital standards are for evaluation treatment of chest pain cardiac patients. It sets up standards for EMS pre-hospital organization with the hospital, for emergency department treatment evaluation, for organization with medications and cardiac catheterizations, a cardiologist, the rest of the CCU, ICU teams to take care of these people. We've often felt we did a great job here at Conroe Regional. This is another piece on a road that the HCA, which runs Conroe Regional, deemed that we should strive for, going to centers of excellence in cardiovascular care. We've got a great group of people. We have a lot of people that were involved in this decision. We have the ability to diagnose and treat myocardial infarction, chest pain in the hospital, at the patient's bedside, with our EMS and aeromedical service that we use to rapidly have those patients seen and evaluated in the emergency department, get the right drugs on board, get them to the cardiac cath lab, and try to reverse any damaging effects from myocardial infarction or artery blockages that we can.
Montgomery County is still an open area, large area. You've got aeromedical services and ambulance. They're able to treat in the field also, right?
Correct. Montgomery County is about 330,000 people in this county, 1,100 square miles. It's a large county. Relatively sparsely populated in a couple of areas, except for Conroe, a little bit in the west in the Woodlands area. There's a long time lag from most people's homes, either by EMS or private vehicle. What we've set up is EMS response teams that can go out, evaluate people at their home, can push cardiac medications, clot busters, if you will, and then notify the hospital and bring them directly in to the hospital for cardiac care, whether that's in the emergency department or in the cardiac catheterization lab, to open up blocked arteries, place stents, etc., do angioplasties, and again, we'll get the rest of the ICU, CCU setup done. With the advent of PHI Aeromedical in our area, we now have the ability to expand the range of about 100 miles. So a lot of communities outside of the Montgomery County area, Walker County, Waller County, Liberty, etc., once they identify problems either at their hospital or with their EMS units, they can now call a helicopter to have those patients flown directly into Conroe Regional for the same basic care that patients receive in Montgomery County.
Now, some of these hospitals are accredited. Are more or less, you said there's, what, 60 in the nation about?
So far, since the Society's been accrediting hospitals, which is the last 2 years, we are about the 60th hospital that's been accredited. The Society has over 500 applications for accreditation for Chest Pain Center, and there's about 7 in the greater Houston area.
And most of those are not really in the downtown area, but more the outlying areas.
They're mostly in the outlying areas. I don't believe there are any hospitals in the Texas Medical Center, the downtown area, that have received accreditation yet. Most of them are in the outliers, and unfortunately most of them are also with HCA as well, West Houston and Clear Lake, etc. So it's a part of the hospital group trying to make a concerted effort to improve the quality of life for their cardiac patients throughout the area.
And how large of a hospital is Conroe Regional?
Conroe Regional is about 250-bed hospital, more or less. We have a cardiac bypass program that's received national accolades. We've got 10 cardiologists. We've got a 20-bed emergency department. We're a level 3 trauma center. So we're, as the county goes, of the 4 or 5 hospitals available to us, we're among the larger of the hospitals available.
And as far as the level 3 trauma centers, what is the closest one besides Conroe Regional?
The closest accredited level 3 trauma center is LBJ Hospital.
Which is all the way down Houston?
Which is down Houston, correct. It's 16 and 59 roughly.
So y'all see quite a bit coming into here also from just basically local
Yes, we are a member of the RAC, which is a 9-county area to try to deal with trauma patients. So we're accredited to level 3, meaning we take care of all patients, with the exception of those with neurosurgical head trauma. So chest trauma, abdominal trauma, multiple extremity traumas, etc. Those patients are preferentially brought here, treated here, or kept here for their care. I said with the expansion of the EMS and aeromedical programs, we can be more of a service to the community and try to relieve some of the pressure from the 2 level 1 trauma centers downtown Houston. Keep our people in our community as well.
First of all, your name, please.
My name is Charlotte Shoemaker. I'm the Director of Cardiovascular Services here at Conroe Regional Medical Center.
Can you spell your last name?
Shumaker. Charla, Sharla.
Tell me a little bit about what you were telling me as far as the heart surgery procedures that you pump and on and off pump.
Conroe Regional Medical Center performs about 300 open heart procedures per year. And traditionally, most patients are done on pump, which means that the heart is stopped, they put the patients on a bypass machine, they perform the procedure, and then they have to restart the heart. Here at Conroe, we have 2 surgeons that perform off pump, which means that those patients, they never stop their heart. We are one of 3 hospitals across the country that's known as a Center of Excellence for our off pump program. Nationally, 20% of the patients receive this procedure off pump. Here at Conroe, 90% of our patients receive off pump surgery is performed on them. And the reason for that is it's a teamwork, but it takes a physician who really has the technical abilities to be able to perform the procedure. Some of the things that it does that's advantageous to the patient is that they have better neurological outcomes. We have a lower infection rate, and there's a lower usage of blood products for those patients.